Welcome back. Shubhodaya. Today's live session at Jivatma Yoga Shale is focusing mainly on the asana sequence that will help people suffering from diabetes to reduce their blood sugar level. So we'll begin the session. Sit comfortably in Sukhasana. Prepare yourself both physically and mentally for the session. Bring your hands to Chin Mudra. Keep your back and neck erect. Look at your body from your tip of your toes to your head region. All your muscles are stressed, stiffed. Try and let go of the stiffness. Try and let go of the stress. Take a slow breath in. Slow and complete breathe out. Breathe in. Breathe out. Take a slow deep breath in. Lengthen your spine. Expand your chest. Hold your breath in. 5, 4, 3, 2, 1. Exhale. Observe the relaxation. We'll begin today's session with 3 rounds of Omkar chanting. Inhale. 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 Observe the vibrations of Omkar. Try and let go of the stress. Try and let go of all unwanted feelings in your mind. Try to be in the present. We'll start the practice with few loosening, Pavana Mukta Kriyas. Place your hands on your knees. We'll start with swinging your upper body very gently, right and left. 1, 2, 3, 4, 5, 6. Slowly drop your right elbow. 7 on the left. 8, 9, 10. Bring your hands at your shoulder level. Continue swinging like a pendulum. 1, 2, 3. Don't hold any muscle. Let all your muscles get loosened with this practice. Inhale, exhale. Stay here on your right side. Give a good pull. Pull your left hand as much as possible. Inhale up. Exhale, drop it on your left side. Inhale up. Exhale, relax. Slowly stretch your legs sideways. We'll start with sideways. We'll start with ankle stretches and knee loosening. Place your hands by the side. Stretch your ankles forward and backward. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. Bring your hands under your right thigh. Slowly bend your right knee. Exhale, stretch. 2, 3, 4, 5, 6, 7, 8, 9, 10. Opposite side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Again, sit in Sukhasana. Cross your legs. With the inhalation, raise your hands up. Exhale, twist towards your right. Drop your hands towards your right. And give a good twist from your waist region. Inhale up. Exhale left. Inhale up. Exhale right. Inhale up. Exhale left. Inhale up. Exhale right and stay there for 3 seconds. Give a good twist from your waist region. 3, 2, 1. Inhale up. Exhale, twist towards your left and hold the position. 3, 2, 1. Inhale up. Exhale, relax. Relax completely. Let's move on to the next loosening. Again, place your palms on your knees. With the inhalation, arch your spine, bring your abdomen front, lift your chin up, give a good stretch on your throat. Exhale, push your spine back, drop your chin on your chest. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up and hold. 3, 2, 1. Exhale down. 3, 2, 1. Inhale, come to the center. Exhale, relax. Let's move on to the next joint, your shoulder joint. We'll begin with hand rotation. Inhale, raise your hands up. Exhale, rotate forward. 1, 2, 3, 4, 5, 6, backward. 6, 5, 4, 3, 2, 1. Relax. Bring your hands on your shoulders. Shoulder rotation. 1. Try to bring your elbows as close as possible and expand your chest. 2, 3, 4, 5, opposite side. 5, 4, 3, 2, and 1. Relax. Place your hands on your thighs. Let's move on to the next. We'll loosen your neck muscles. Inhale. Exhale, drop your head towards your right shoulder. Try to bring your right ear closer. Inhale up. Exhale left. Inhale up. Exhale right. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale up. Exhale down and stay there. 3, 2, 1. Inhale up. Exhale left. 3, 2, 1. Inhale, come to the center. Exhale, relax. Relax completely. Slowly stretch your legs sideways again. Bring your hands by the side. Gently tap your legs. Loosen the thigh muscles. Loosen the calf muscles. Slowly bend your right knee, bend your left knee, come to standing position. Stand comfortably in Samasthiti. We'll do few loosening in this position in standing, and then we'll move to Surya Upasana. The first one would be spread your legs. With the inhalation, raise your hands up, interlock your fingers, exhale, bend forward, try to come closer to the mat. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down, and stay there. 3, 2, 1. Inhale up, exhale, relax. Relax completely. We'll move to Surya Upasana. Bring your feet together. Come to the front of the mat. We'll start the practice. We'll begin from your right side. Bring your hands to Namaskara Mudra at your chest level. Inhale, raise your hands up. Arch back. Exhale, bend forward. Inhale, right leg back. Drop your right knee, look up. Exhale, come to plank pose, Samatolasana. Exhale, drop your knee, chest and chin to the floor. Pull your stomach in. Inhale, up, Bhujangasana. Exhale, down, Parvatasana. Inhale, right leg front. Drop your left knee on the mat, look up. Exhale, left leg front. Inhale, up. Exhale, relax. Let's continue. Second round. Bring your hands at your chest level again. Inhale, raise your hands up, arch back. Exhale, bend forward. Inhale, left leg back. Exhale, right leg back, come to plank pose. Exhale, knee, chest and chin to the floor. Chest will come in between your palms. Inhale, up to Bhujangasana, feet flat on the floor, relax your shoulders. Exhale, down to Parvatasana. Inhale, left leg front. Look up. Exhale, right leg front. Inhale, up. Exhale, relax. We'll continue one more round or one more set of Surya Upasana. Very slow, gentle movement. Today's practice is asanas or poses for people suffering from diabetes, type 2 diabetes. Diabetes is such a disorder which is not caused because of any physical issue. This is more to do with the stress level, the psychosomatic disorder. So today's practice will focus on Pancha Kosha, the 5 sheath or the 5 layers of our body. Annamaya Kosha, Pranamaya Kosha, Manomaya, Vijnanamaya and Anandamaya Kosha. So, as soon as we complete the Surya Upasana, we will start the asana sequence. This is very good. This is not only for people suffering from diabetes, this also involves the overall improvement, overall wellness of a human health. So anybody who is stressed out because of the lockdown, who is stressed out because of the work pressure, stressed out due to many other reasons, can still practice, because this has many restorative asanas which will restore your energy levels. We have just completed the Surya Upasana. You can stand in Samasthiti, hands by the side. Take a slow breath in and breathe out. Observe the stretch of your muscles during Surya Upasana. Take slow, long breath in. Slow and complete breathe out. Breathe in, breathe out. We'll start the practice. Slowly, gently open your eyes. Come down on the mat. Lie down on your back in Shavasana. So as I mentioned before, this asana is not stressing too much on twisting. This is an overall workout for your body, overall relaxation for your body, and we will definitely concentrate on twisting and stimulating the pancreas, but this is starting from your relaxation, which helps to relax, let go of the stress and prepare your body for the practice. The very first asana in this sequence is Viparita Karani. So there are several variations of Viparita Karani. You can do the most relaxing one. You can go close to the wall. We will not demonstrate here how do we go close to the wall and raise the leg. Here we will do a simple one who can do at any location. Slowly bend your knees. Bring your hands under your hips. Gently lift your hips off the floor. Place your hands under your hips. No. Drop your lower back. Support your hips with your hands. Yes, just like that. And now slowly raise your legs. Keep it at 90 degrees. So if you cannot place your hands under your hips as shown here, you can still do this with the help of a cushion or a blanket. And also you can make sure the leg which is not supported is on the wall. So this is very good asana to reduce or lower your stress levels. It will help to lower the blood pressure. Starting, the benefit is lowers the blood sugar level. It can also help to relieve headaches, boost energy and increase the circulation. As the legs are raised against the gravity, the blood flow is on the reverse direction, which will make heart easier to pump the blood efficiently. You can hold this position for few seconds and then feel the changes in your body and slowly come back to the position. Bend your knees, drop your legs, and you can slowly release your hands. So the blood would have rushed to your middle part of your body. Stay here for a few seconds and slowly come up to sitting position. Always try to come from your right side. Keep your legs stretched, sit in Dandasana. And the next asana is Supta Patangasana or Supta Baddha Konasana. You can bend your legs at your knees. Bring your toes together. If you're not comfortable, you can just loosen the hip joint by doing few flaps, butterfly flaps, very slowly and gently, up to 10 counts. 7, 8, 9 and 10. And when you feel your hip joints is flexed, you can slowly recline and lie down on your back. Very gently take your hands back, support your elbows and then slowly drop your shoulders. Very gently, do not rush. Let your legs be in the same position, toes together and knees bent. If you feel your legs are coming up, you can place your hands on your thighs and don't push it too hard. Gently hold it, trying to make sure your legs are on the mat. If not, you can just support. You can place a cushion or pillow under your legs and rest your legs over there. This is also a restorative asana which can calm down your nervous system. This pose helps to reduce your stress level to a great extent, lowers your blood sugar, and stimulates the abdominal organs, bladder, and kidneys. So, these are the three organs which would be impacted as soon as people start suffering from diabetes. So, we are focusing on these three organs: your abdominal organ, your bladder, and the third one is your kidneys. Hold this position as comfortable as possible with a normal breathe in and breathe out. Again, to remind, we are not stressing too much. People who want some kind of intense workout can slowly take your hands, press your legs towards the floor, and enjoy the stretch on your thighs, which is very good to tone up your thigh muscles. You can stay here for a few seconds. 5, 4, 3, 2, 1. Slowly stretch your legs. Turn towards your right again and come up to sitting position. Continue keeping your legs in Dandasana, seated posture. The next asana is Paschimottanasana, forward bending. You will not reach the knee towards your forehead, rather, you will just keep your spine straight and stay there. We'll see how this asana looks. Inhale, raise your hands by the side, pull your spine up, lengthen your spine as much as possible. Exhale, come towards your toes, hold your toes, and now adjust your spine, try to keep it straight. If you cannot reach your forehead to the knee, you can continue staying in this position, because this is also good asana which creates the pressure on your internal organs, the abdominal muscles. You can continue staying in this position. From here, we slowly start to include the asana which will be helpful for people suffering from diabetes. This is one of the best asana to reduce the blood pressure. The key thing is it will promote weight loss, relieves anxiety and fatigue. So you can, people looking for intense stretch, they can slowly exhale and come towards the knee and place your forehead closer to your knee. People who want even more intense, they can place the chin in between their knees and look in front. Whichever you feel it's intense, but make sure you're not injuring yourself. You'll stay here for 5 seconds and then slowly come up. Inhale, raise your hands up. Exhale, drop your hands by the side and relax. Relax completely. Feel the stretch. Feel the compression on your abdomen. We'll move to the next asana, Sarvangasana, shoulder stand. People who may not be able to do the shoulder stand, they can repeat Viparita Karani. They will get the similar benefits as shoulder stand, as Sarvangasana. Slowly lie down on your spine in Shavasana. We'll prepare for Sarvangasana. Bring your legs together. Bend your legs at your knee. Slowly lift your hips. Lift your feet off the floor. Roll back. Bring your hands under your hips. Find your balance. Slowly lengthen your knees. Keep your knees straight. Make sure your chin is resting on your chest. Make sure your back is straight. It's not falling towards the floor and your leg is not inclining towards front or back. You can hold this position as comfortable as possible. This inversion asana will help to improve the circulation, similar to Viparita Karani as I was mentioning. And the second most helpful benefit of this is it stimulates the thyroid glands that is placed at your throat region, which helps to produce the TSH, thyroid stimulating hormone, which in turn will help us to generate T3 or T4 hormones. It will also help to calm down your mind, relieve the stress. So by holding in this position, there's a reverse flow of blood, and this is very good for people suffering from varicose vein too, because there is a excess fluid that's stored in your legs being distributed into your body. Hold this position for a few seconds with normal breathing and gently we'll come back. Bend your knees, slide your hips on your palms, slowly drop your legs on the mat and lie down in Shavasana. Relax completely. So all these practices are not only for your Annamaya Kosha, this is also for Pranamaya Kosha, where we are focusing on your breathing, and also to your Manomaya Kosha, where we are making sure the stress levels are coming down. We'll move to the next asana in the sequence, Halasana, plow pose. Again, bring your feet together. Bend your legs at your knees. Lift your hips, lift your feet off the floor. Take your hands under your hips. And then slowly start dropping your legs on the floor. Once you find comfortable, your toes are on the mat, on the floor, you can try to straighten your knees with the support of your toes and bring your hands in front. If people are not confident, they can still hold their hips with their hands. If not, you can also drop your knees on your forehead, because this is not concentrating on how well you stretch. This is concentrating on few other therapeutic benefits. I'll mention those therapeutic benefits. This inversion will stimulate the thyroid glands, which is on your throat region, increases blood circulation, reduces stress. It relieves backache, headache, and the most other common disorder, insomnia. So as the blood is rushing towards your head region, there's this therapeutic benefit which cures, which reduces to great extent insomnia. You can hold this position and slowly release your hands, support your hips, raise your legs off the floor, keep it straight, continue, and slowly change your hand direction. We'll come to Setu Bandhasana, because this is a reverse stretch for your spine. Drop your legs on the mat and make sure your hips are off the floor. You give a good reverse stretch. This asana is very good to relax the back pain, tone up your thighs, strengthen your thighs, stimulate the thyroid glands at your throat region. You can hold this position for a few seconds and then slowly drop your hips on the mat with an exhalation. Halasana is also good for people suffering from indigestion, gastric issues, because there's a compression on your abdomen when you do halasana. You can relax in shavasana. The next asana we are moving in this sequence is Urdhva Mukha Shvanasana. Urdhva Mukha Shvanasana is upward facing dog. You can lie down on your abdomen, roll towards your right and lie down on your abdomen. We will do this asana step by step. So you will bring your hands at your chest level. Your feet will be flat on the mat. Your legs will be apart. You will not keep your legs closer as we do in Bhujangasana. In Urdhva Mukha Shvanasana, it will be apart. With an inhalation, you will slowly start lifting your chest up, straighten your elbows, and then when you feel confident, lift your lower part of your body and come on your toes. Lift your knees off the floor and from here arch back as comfortable as possible. Drop your head back. Give a good stretch on your throat region. This is an asana which stimulates your back bending. This strengthens your muscles. This pose helps to lower the blood pressure. It increases blood circulation. It promotes weight loss. It also stimulates the abdominal organs as it is stretching the abdomen. You can hold this position with normal breathing for few seconds and then slowly drop your body on the mat. Bend your hands at your elbows. Bring your chest closer to the mat and relax in Makarasana. So as I was mentioning earlier, we are not only concentrating on stimulating your pancreas, which will increase your insulin production. It's the overall wellness of your body, because this asana strengthens your muscles, promotes weight loss, and at the same time helps to reduce the fat on your abdomen, which is one of the biggest cause for diabetes. We'll move to the next asana from here, Dhanurasana, bow pose. Bend your legs at your knees again. Release your hands and you will hold your ankles. So you will hold your ankles from outside, not from inside. So here, with an inhalation, you will stretch your legs and you will slowly lift your chest. Do not focus on coming up completely if you are a beginner. If you have practiced few months or few years of yoga, you can try to come up to the actual pose by stretching your leg as much as possible, as shown here. This is another back bend which helps to open up your chest and stimulates your abdominal organs. This will help to lower your blood sugar level to great extent. This also helps to relieve constipation. As the chest is expanded, the respiratory ailments is reduced. You can hold this position and then slowly come down. In this position, you can also make sure your thigh muscles are getting toned up. Your lower back is strengthened. The glutes are getting worked out. The hamstring, the quadriceps are also getting worked out. So yoga is one such beautiful workout for your body which covers overall wellness for your body, overall strengthening of your body muscles. We'll move to the next asana in the sequence. Now we start focusing on the twisting. The first asana in the twisting is Ardha Matsyendra Asana. Slowly roll on your back and come towards the sitting position. Sit in Dandasana. Ardha Matsyendrasana. People who cannot do Ardha Matsyendrasana will help them to perform Vakrasana as well. So we will start Ardha Matsyendrasana. Slowly bend your legs at your knees. Take your right leg under your left knee. You will support your heels on your lower back, on your buttock muscles. Bring your left leg on your right knee. Now, the simple and the most efficient way of remembering is the leg which is bent and leg which is facing the sky, that hand goes back. So, in this scenario, the left hand goes back, supports your spine. Your right hand with the inhalation gets stretched up, and then you can wrap it from your left side. So we are showing the actual pose of Ardha Matsyendrasana. Will help to do the simple ones as well. You can hold your left toe and give a good twist. People who may not be able to perform this effectively will show how they can do the variation and then slowly progress. We'll hold here for a few seconds. 3, 2, 1. Relax the hold. Let's demonstrate the variation 1. You can hug your knees as has been shown here, and then twist towards your left. The hand which is supporting your spine, look towards that hand, look back and give a good twist from your waist region. And we'll do the other variation also, where you will push your leg with the elbow and keep your hand upright. Yes, you can do this variation as well. As I was mentioning, this is a twisting asana which stimulates the abdominal organs, which will help to lower your blood sugar. It also improves the digestion, boosts your energy level. The other benefits, the physical benefits, it helps to keep your spine straight, which is improving to keep your posture correct. With the inhalation, slowly raise your right hand up, release your twist, exhale, relax. Keep your legs straight. Let's perform the same on the other side. This time, you will bring your left leg under your right knee, place your heels under your right buttocks, take your right leg over your left leg next to your left knee. This time you will take your right hand back. We'll do the second variation so that people will be able to see properly. Very good. You're hugging your knees and twisting. Twist from your abdomen. You should feel the twist, which will help to reduce the belly fat, which will promote weight loss, increases the digestion, helps to relieve excess unwanted gas in your intestine, stimulates the pancreas to produce appropriate level of insulin. Inhale, exhale slowly, twist again, and this is the final pose what we demonstrated. Inhale, release the twist, release your hand, exhale, relax. For the benefit of the others who may not be able to do Ardha Matsyendrasana, we will do Vakrasana. Bend your right knee, place it closer to your left thigh, and make sure there's one palm distance. And now you will inhale, take your right hand back, and take your left hand, wrap it on your right leg and twist. Again, in this asana too, you can try to hold your right toe, but if you're not able to do it, you can do the variation as we have demonstrated earlier. Give a good twist. This also helps to relieve the back pain. So any spinal injuries, they can also perform with the advice of the doctor or a yoga instructor or a yoga guru, because the injury depends from person to person. Inhale, release the position. Exhale, relax. Let's perform the same on the other side, and then we'll move to the next asana. Bend your left knee, take your left hand back. Inhale, raise your right hand, wrap it on your left leg and give a good twist. Look at your left shoulder and continue holding this position. So here you'd have noticed Prinand is taking his hand slightly away from his body because he has a long hand. So he may not be able to keep it close because his shoulders shrugs, it comes up, which will injure his shoulder. So the normal people who is having a normal length of hand, they can place it very close to their buttocks, which will make sure the spine is not leaning. Like a person like me, I have a short hand, so you can twist and stay there. Inhale, slowly come up, release the twist. Exhale, relax. So the next asana in this sequence is spinal twist, Markatasana variation. You will lie down on your spine, bring your hands at your shoulder level, bend your legs at your knees. You will bring your feet together. Now there's two variations. You can just drop your legs as is without lifting your legs as we are showing here. If you want more intense workout, you can lift your feet off the floor and slowly keep it at 90 degree. Bend your knees. Yes. Now drop it right and left. Yes, this way. 1, inhale up, exhale down. Inhale up, exhale down. This is again restorative twisting pose, which helps to stimulate your abdominal organs. This will help to reduce your blood sugar level. This pose elevates the pain, stiffness in your spine, back and your hips. So continue for 5 to 10 rounds, and then you can hold on one position and stay there for 5 seconds. 5, 4, 3, 2, 1, and then we'll do the same on the other side. Drop it on your right. 5, 4, 3, 2, 1. Inhale up, exhale, relax. Relax. You can rest here for a few minutes before moving on to the next asana. The next asana is also not an intense workout. It's a relaxing resting pose. So people wanting to come up, they can come up to sitting position. Slowly turn towards your right. Come to sitting position. So we are demonstrating a variation of child's pose, variation of Balasana, where people may not be able to sit on their heels in Vajrasana. And then we'll demonstrate the actual position. So from here, you will inhale, raise your hands up. Exhale, bend forward. Bring your hands closer to the floor. And then slowly walk your fingers front and try to rest your head on the floor. If you're not able to reach your forehead onto the floor, you can stay here, or you can drop your head on a cushion, on a pillow, or on a block, whichever you find it handy, and you can rest your head. You may not leave your head hanging there. You can rest it there because it may injure your neck. So this is the final pose, what I was talking about, resting your forehead on the floor. With an inhalation, slowly come up. Exhale, relax. Now we will demonstrate the actual Balasana. Slowly stretch your legs, or from here you can come directly to Vajrasana, whichever you're comfortable. You will spread your heels, rest your buttock muscles in between your heels. With an inhalation, slowly raise your hands up. Exhale, bend forward. Give a good stretch from your spine. Reach the floor. Press your abdomen on your thighs and drop your head in between your knees on the floor. As I was mentioning, this is a resting pose which encourages relaxation, which helps or promotes the production of insulin production. Insulin beta cells production. So as I mentioned in the beginning of the session, diabetes or any modern ailments, non-communicable diseases are all caused because of the stress. Due to stress, our internal organs do not function in the right way it should function. So in this resting pose, you're not only stimulating your abdominal organs, which is pressed against your thighs, you're calming down your mind. Your entire body is resting, which will promote insulin producing beta cells. So the beta cells will trigger the production of insulin. It relieves the back pain, neck pain, stress and fatigue. You can stay here for few minutes because this is one of the best relaxing as well as therapeutic asana, Balasana. When you're comfortable, you can slowly inhale and come up. Exhale, relax. We'll move to the last asana in the sequence, the most challenging asana, Shavasana. Release your legs by shifting your body weight on one side. Stretch your legs and lie down on your back. Shavasana, the most difficult asana, because in Shavasana we need to make sure your body is rested. It's just collapsed. You're not holding any muscles. Your entire body, the stiffness of your muscles is rested. You're resting on the mat. And the whole concept of Shavasana is there are no thoughts. So it's very difficult to not have thoughts, and it's very difficult to stop the thoughts, because as you know, you try to stop something, there's more pressure created. So we do not recommend to stop your thoughts. You will have to look at those thoughts that appear. It could be a random thought, it could be a connected thought, it could be relevant thought, irrelevant thought, pleasant, unpleasant. Let go of them. Try and look at them and let go of them. By letting go, you are making space, you are freeing up the occupied space in your subconscious mind to occupy with fresh, wanted thoughts, pleasant memories. You're encouraging your subconscious mind to get refreshed, relaxed. Continue in this position, Shavasana. This is one of the best restorative pose that will help to lower your blood pressure, relax your entire body, helps to calm down your mind. It also helps to relieve headache, fatigue, and it helps to people suffering from insomnia. You can continue relaxing in this position without holding any part of your body, without holding on to any thoughts. When your body and your mind is prepared, is comfortable to come out of this position, you can slowly bring your feet together. You can place your left hand on your abdomen, raise your right hand over your head, slowly bend your left knee and turn towards your right, and you will rest your body in this position for a few seconds. You bring your awareness towards your body, and when your body says you're ready to come up, with the support of your left hand, slowly come to sitting position. Sit comfortably in Sukhasana, cross-leg pose. Place your hands comfortably on your knees. You can either adapt Chin Mudra or you can place it open. Make sure your palms are facing the sky, because this increases the intake of oxygen. Inhale slowly and deeply. Exhale completely. Just recall all the practice you have performed. Try and balance the Panchakosha. Relax. Dhanyavada. Happy practice. Take care. Have a safe and wonderful day.